Well, there's been a lot of attention in the last 2 or 3 years around claims that sweeteners can adversely affect human health via the impact of the sweeteners on the gut microbiota. So it's kind of riding the wave of interest currently on gut microbiota, which is supposed to affect every aspect of our health. But on current evidence, I think that this could be described as a major myth in terms of low-calorie sweeteners and microbiota. The claim is based in part on evidence that differences in microbiota composition are associated with common diseases and disorders. The ones that are most relevant are obesity, type 2 diabetes, and metabolic syndrome. And actually, there's quite a lot of evidence for this. If you compare, it comes from comparing, say, lean individuals with obese individuals, look at their microbiota, looking at type 2 diabetics versus control healthy subjects. And they do show differences between these groups. But there are a number of limitations and caveats to this sort of data. First of all, we don't know whether the association is causal. It may be that having type 2 diabetes and obesity alters the microbiota. Also, very importantly, there's not much consistency between the studies in terms of the types of bacteria involved at the species level, the genus level, even at the phylum level. Some of the early studies were showing big differences between obese people and lean people in what was called the Firmicutes and Bacteroidetes ratio, which are the two main phylums in the gut. But then subsequent studies, about 20 studies altogether, subsequent studies showed either the opposite effect or no effect at all. So currently, it's not really considered possible to use changes in the microbiota